hardly ever wear a bra. That's part of why I know I'm not gonna get breast cancer, even though I've got 3 genetic things that are pushing me in that direction. I'm not worried about it. And if I do, I'll treat it. I'm not worried about that either.
You treat me.
Pardon?
You treat me as well.
Do I treat what?
Me.
Men.
as well.
Yeah, oh, I have men. Yeah, I have lots of guys. I've got lots of guys. Okay. I've been going for 40 minutes. What questions have I not answered?
I have a question.
Uh-huh.
When do you start getting tested for your hormones?
You know, it would be great when you were like in your early 40s or so, and you're feeling really good to get your hormones tested and see where you are.
I'm going past that, so.
Okay, but that, I mean, that would be really
Okay.
good, so that you could see, because
So you have like a baseline?
yeah, a baseline. I mean, what a concept. Let's see where I am. Okay. Generally we don't get that opportunity, and we start getting levels when people start getting symptomatic. But most women start getting symptoms in their late 30s.
Mhm.
The PMS starts coming on and it is much more severe than it has been. You start getting irregular periods, getting moodier, etc. More breast tenderness, which tells you you've got too much estrogen relative to progesterone. You should not have any breast tenderness if your hormones are balanced. You shouldn't have any PMS if your hormones are balanced. And the treatment for PMS is not another SSRI drug. Okay, it's not a deficiency of an SSRI. It's an imbalance of estrogen and progesterone. Okay, the question about osteoporosis. I think I answered that. Were you satisfied with that?
That was me.
That was you. I know. I'm looking at you.
Oh, I'm sorry.
Okay.
Yeah, I was just curious, once you start on these
Hormones.
hormones, do you take them for life?
It varies with the woman. The recommended, let's see what conventional doctors say. I don't remember. They basically say go on them, but stay on them for the shortest period of time. And it used to be like 5 to 7 years that they would say that. I don't know if that's in the consensus statement. Watch for a hyperlink. There it is, the global consensus statement. Okay, now what I did, I picked up all the parts and pieces of this statement that I agreed with. There were a couple of them I didn't agree with, so I didn't include those. But I'll take you to it. But they still put a time limit on it. Right. All of you probably know women, though, who are in their 70s and 80s and who are doing just fine, probably on Premarin, because that's what they were started on many, many moons ago.
My mom's 75 and she's still on Premarin.
She will age more gracefully. She will have less cardiovascular disease. It's not that she has no risk of having cancer, but she has a lower risk and she has a better chance of surviving it. One thing we've seen with women who were on hormones, who were like on the Premarin, like your mom, if they get breast cancer, usually it's a milder breast cancer. It's not one of these weird triple negative, very aggressive cancers. It's usually a fairly mild one. So the most effective treatment for vasomotor symptoms. They are no longer saying SSRIs or barbiturates or clonidine or benzodiazepines, which is what they started putting women on when the Women's Health Initiative said hormone replacement therapy was bad. They're back to estrogen. It is the best, this is menopause hormone therapy. They changed the name of it. I think that's cute. Is effective and appropriate for the prevention of osteoporosis-related fractures, okay, in women who are 60 years or within 10 years after menopause. I put women on hormones who are way more than 10 years past menopause. And I don't put them on high doses, I put them on very, very low doses, and it turns their life around. You don't need real high doses as you get older. I didn't put that in this article, because it's too controversial. Standard dose estrogen alone, meaning Premarin, okay, may decrease heart disease and all-cause mortality in women who are younger than 60 years and within 10 years of menopause. Data on estrogen plus progesterone in this population show a similar trend for mortality That's not true. There were more women who died with, or who had heart disease with the Provera. But in most randomized clinical trials, no significant increase or decrease in coronary heart disease has been found. There's more problems when you have Provera. Local low-dose estrogen is preferred for women whose symptoms are limited to vaginal dryness, plus a little bit of testosterone, but I also told you you need a little bit of progesterone. Estrogen as a single systemic agent is appropriate for women after hysterectomy, but additional progesterone is required in the presence of a uterus. I think that women need natural progesterone, even if you don't have a uterus, because your brain needs it. Your bones need it. And then they basically throw it back on you guys and say, it's up to y'all. You make the decision. And they say, you know, you have to look at the risk versus the benefits. The risk of thromboembolism, which is basically clots, and ischemic stroke increases with oral hormone replacement therapy, but the absolute risk is rare below the age of 60. So they're going to say, try to come off of it before you turn 60. Okay, I'm going to disagree with that. Your body's going to stay younger as you get older. The risk to a woman of having a heart attack, once you don't have enough estrogen, your cardiovascular system starts aging faster, the same way it does, more like in guys, because the estrogen protects our cardiovascular system. And so there is some slight increased risk of adding estrogen back into a woman who already has older coronary artery disease, or older cardiovascular system. Does that make sense? Okay. But if you don't swallow the estrogen, there's much less risk. You use it topically and you use low doses. And you don't dump a whole lot into your system. There are physicians out there who are integrative physicians who give you a whole bunch of estrogen if you haven't had it in a long time and say your breast's going to be really sore for 3 months. And then you'll feel great. And they also push the doses really high. I don't know if any of y'all went to this place that had the pellets here in town. You know, they were putting it underneath your skin. And their normal range for testosterone was 100 to 300 for women. The recommended range is 30 to 80. So I had women in their 70s coming in and saying, can you control this? I can't get enough for my husband. I'm wearing him out. She was so cute. But I looked at some of their records on other patients, and it was just nonsense where they were pushing these women's hormone levels to. And these women felt so dynamic, you know, and it's kind of like, yeah, but you don't need levels that high. You really don't. So you need a little bit, not a whole lot. And each woman's different. Each woman's different in terms of, I can't tell you that, I mean, I can tell you that most of the women that I treat are on something equivalent to a 0.025 to 0.05 patch, if that means anything to you. Okay, so like half 0.5 estrace, 0.625 Premarin. Most of the women I'm treating are on those doses. They're not on 4 times that. They're on low doses and feel just fine. And part of it's because we're using lots of different hormones. You don't have to I'm just not pushing one hormone to the max. You're much better off balancing several different hormones. So they'll get a sprinkling of DHEA, a sprinkling of testosterone, they'll get a little bit of progesterone, and all of it works together. The risk of breast cancer in women over 50 years is associated, they say is a complex issue. Turn the page. Primarily associated with the addition of a progestogen to estrogen therapy. It's not the estrogen, it's the Provera. And to duration of use. Dose and duration of hormones should be consistent with treatment goals, and safety issues should be individualized, yeah. In women with premature ovarian insufficiency, systemic hormone replacement therapy is recommended at least until the average age of natural menopause. My sister went through chemo at age 45 for anal cancer and radiation therapy, and went right into menopause. And her impression from her family doctor was that she shouldn't be on hormones because hormones were dangerous. It's kind of like, no, you're going to lose bone. You at least need to be on hormones until age 51. But there are women who were not put on hormones when they had a hysterectomy and had their ovaries taken out, and they were in their 30s. If you look at these women, they look so old. They're aging. They're aging on the outside. They're aging on the inside. It's just a tragedy. So I agree with this. They don't like custom compounded bioidentical hormones because they don't. And then current safety data do not support the use of this in breast cancer survivors. So they would say, no, you can't have it. And most integrative doctors would say, if it was DCIS and there was no evidence of any spread, et cetera, then let's clean you up, okay, and put you on low dose. Okay. So those are some of the controversies that I deal with every day. Other questions?
Is there a different approach if you had a real early hysterectomy and you started having hot flashes at 15?
No, you still go on estrogen. You go on estrogen and progesterone and testosterone.
Well, right after a hysterectomy, the very next day, they put me on that estradiol or something.
Estradiol,
Mm-hmm.
on a patch,
No,
No.
it was a pill.
uphill.
And they left me on it for 5 years. They took me off, put me back on it, took me off, didn't give me anything for I don't know how long, and then a patch for a few years, and then just all of a sudden took it off and I've had nothing since.
So how long has it been since you've had any estrogen?
Probably 20 years.
Okay. So you'd have to evaluate what's the risk and what's the benefit to you.
Because
Are you still having hot flashes now?
But I eat soy every day. That's helped a lot.
It will. It will. And all of this
Have
stuff
it
about
every
soy,
morning for breakfast.
all this stuff about soy being bad for you.
It works.
It's soy is healthy for most women. I'll just put it that way. But it has to be. It has to be organic. Okay. Otherwise, you're getting a nice dose of Roundup every time you eat the soy.
Mine's in protein powder.
Just make certain it's organic. Oh yeah. Oh yeah. And that's going to increase your risk of cancer and make you fat and all kinds of things. If you get too much progesterone on board, you get a squashing of your emotions. There's no passion. Who was the gentleman who brought progesterone to this country? What your doctor doesn't tell you about?
Dr. Lee.
Dr. Lee, okay, who actually took it from the OB-GYN in England, whose name I can't remember right now either. Can you tell my estrogen's getting low? It's been 12 hours. He said in one of his lectures, which I just loved because he had this merry sense of humor. He said, well, the house just burned down. If you have too much progesterone on board, it's just a house. The IRS is coming. It's only money. Just no concern about anything. Okay. Now, if you are not on estrogen, you may need more estrogen too. Do you have any idea what your progesterone level is?
No,
Okay, you need to find out do you use cream or use pills?
pills.
Okay, so do you take them at night?
I do.
Okay, then go in one morning and say, I want a progesterone level. You want it between 12 and 25 on average. Few people need high, some people need it higher, but generally somewhere between 12 and 25. If it's much higher than that, then you need a lower dose of progesterone. But you're not going to get spark back in your life without some estrogen and probably some testosterone. If women don't have enough testosterone, they become brown sparrows. They become doormats. You have a hard time speaking your truth. You become very uncertain of yourself. You lose that sense of confidence. You lose the courage to be in the world. Everything is just too complicated. I will just stay home and watch movies. just can't handle all that.
And that's too little what?
Too little testosterone.
Interesting.
Am I, not, yeah. And you know, it's not just about libido. It's about having vitality. It's about wanting to engage in the world.
And what are the normal levels for testosterone?
30 to 80. Now, all of these are averages, okay? I mean, you know, if you were one of these women who's really strong and muscular, and you were on the bottom layer of the pyramid of cheerleaders, okay, you probably would function pretty well somewhere between 70 and 100. Yes.
Do you get your period again if you take these?
I hope not. Like I said, I'm not a Suzanne Summers doctor, but 99%, 95% of docs like me do not feel like you have to cycle enough that you have a period.
So these hormone levels are for after you've already stopped your period. They would be different when you still have your period?
Yes, oh yeah. Oh, when you still have, well, progesterone's about the same. It can be higher. Your estrogen levels, if you're still having periods, the best day of the month to get your hormone levels is day 21 of your cycle. And, I mean, your estrogen levels might be 120, they might be 240, they might be very, very high, okay? And you want to balance out that with progesterone. They'll be much, much higher when you're younger. Okay. Docs who have been prescribing the bioidenticals for decades, they don't see breast cancer. They just don't see it. Now, is it the estriol? Or is it the fact that they don't just give the woman the hormones? They have her clean up her diet, they make certain she's sleeping well, is she happy, does she have good social support, is she right with her mentor? I mean, we take a very broad approach to it. So I think all of those things help you age more gracefully. Okay, it's 7 o'clock, people have appointments, need to leave, scoot. And I'll be here for any additional questions you have. I hope this has been helpful to you.
Thank you.